This big change from the CDC to keep businesses running in spite of those hospitalizations and the pandemic, they have narrowed the isolation window from 10 days, which we've seen for months now, to 5 days for those who have COVID-19, but you have to be asymptomatic. The new guidelines come as we deal with one of the most contagious variants of COVID-19. Here to walk us through the science behind these newest guidelines, immunologist Dr. Purvi Parikh. Dr. Parikh, good morning to you. This is a major announcement. It seems as though there has been a shift or we've seen progress in the science. What do you think is sparking this change?
Right. I think the primary driver of this change actually is the massive labor shortages that we're seeing, not only in the healthcare industry, but in other industries. And yes, the science does show that you are the most contagious in the first 5 days. But again, that can vary greatly from person to person. And there is still a lot left for interpretation. Many may not realize that you have to be asymptomatic to shorten that window. And so there's also a lot of concerns that this could contribute to the spread if people don't follow these new guidelines properly.
Well, and it's interesting because for over a year, and even to small children, we were telling them, if you're asymptomatic but you test positive, you don't want to get around your grandma and grandpa. You don't want to get around those who have immunocompromised conditions, even though you're not portraying any symptoms. So did that change? Did we learn more about the fact that we're not as contagious when we're not as symptomatic?
So we are less contagious when we're asymptomatic because we have less of what we call that viral load or virus replicating inside of us. So we're less likely to pass it from one person to another. But the tricky part of being asymptomatic is that you don't know how long you've been asymptomatic for, right? Because you don't have any symptoms. So that's the part that concerns me the most of how people will be able to tell, that this is day 5 or day 2, right? So yes, the science does show you're less likely to spread it if you're not coughing or sneezing or having a fever, absolutely. But again, with everything, the devil's in the details. So I hope that, it's enforced properly. The other change too, as you know, is that people who are more than 6 months out from their vaccine or 2 months out from the J&J vaccine also have to quarantine now for 5 days and then wear a mask for 5 days. And I worry that may also be very confusing for people because until now, we've been saying if you're vaccinated and exposed, you don't necessarily have to do those quarantine measures, right?
Yeah.
Unless you're sick.
Keeping all of that straight is most parents can't keep straight what their children's homework assignments are and when they're due. How are they going to keep straight everything? Is there going to be this blanket push, even with these new guidelines, just keep your mask on everywhere?
For the winter time, I personally think that's the safest because that does significantly reduce transmission from individual to individual. The silver lining, though, is that children have missed a lot of school from these asymptomatic positives. So maybe this is a good push to help kids get back to school safer. I worry more about these guidelines in adults and adults following them properly with the right timing.
Yeah, and it is interesting that you mentioned the labor shortages. It just seems like that's a mixed message. Okay, now that we're under more economic pressure, it's really only 5 days versus 10. Should it have been 5 all along is what I think a lot of people would be at home asking.
Right. It does send a very confusing message because, we were told that this incubation period can last anywhere from day 2 to day 10. That this is such a contagious variant, right? That we want to curb the spread of it. And so it is very confusing to the general public, I think, then to shorten those quarantine times because then it really sends a mixed message and makes people a little bit lost as to what the right thing is to do.
There's antiviral pills out now. More and more of these brands are showing some promise. Are they relying on these in terms of the healthcare system? Are they relying on these as a backup, especially for those who would be the most likely to contract COVID-19?
Well, I hope not. Even though these are more tools in our armamentarium, we still have very limited doses of both the Pfizer as well as the Merck pills, and while it's great, we're in much better shape than we were a year ago as both of these pills help keep you out of the hospital. Again, they're not without risk and they're not 100% guarantees as well. But, it is nice for those high risk individuals that now there's a backup plan that if you still do get sick with this very very contagious variant, despite being vaccinated, or if you haven't had a chance to get your booster yet, now we have two very efficacious treatments, especially the Pfizer pill.
All right, Dr. Parikh, thanks for keeping it real with us. We really appreciate it. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.